exactly what you're doing is following your body. This is perfect.
Expecting mothers know.
We're holding hands and then in the water.
Yes.
Preparation is key.
I want you to think good thoughts. I want you to support Keisha during the code, right? This is a contraction.
Keisha Credit and her partner Adama will welcome a baby boy in a few weeks.
Having a birth plan before it's time, getting prepared months ahead of time so that whatever shifts happen in your body or with the baby or whatever, you're not blindsided.
It's a feeling Keisha has felt before. As a Black woman, she knows what it's like to not be heard by a doctor and having to fight for what she needed.
So when it came to pregnancy, I had that memory in the back of my mind of, you know how to advocate for yourself. Do that here.
A recent report from the CDC reveals that maternal deaths in the U.S. spiked in 2021. For Black women, the risk is even higher.
If you're not being heard, if people believe you have thicker skin, if they're not treating your pain, you know, all of the sort of lies and myths that have been told about Black people within the context of healthcare and health services provision, they get perpetuated.
Monica McLemore is the interim director for the University of Washington Center for Anti-Racism in Nursing and Equity. She says there's another fact that is being ignored.
Let's talk about Serena Williams. She's a really great case study in, oh, I didn't die, but I almost did. Right? So we don't talk about near misses.
Back in 2018, the tennis star revealed that she had major complications after she gave birth. She suffered from a pulmonary embolism and blood clots in her lungs and legs.
She knows her body better than anybody else because she is a multi-million-dollar paid athlete, and nurses still didn't listen to her.
Serena is not alone. In the latest CDC report on maternal morbidity, about 50,000 to 60,000 pregnant women face serious complications each year.
I don't want to die. That was literally the main part of hiring me was just, I don't want to die.
Jasmine Williams is the founder of Blackberry, a local doula center in Burien. After her own traumatic births and an emergency uterine procedure called a DNC, she became a doula to support Black women.
I had to be rushed to the emergency room the day I was discharged, and I had a DNC without anesthesia done on me by a cisgendered white male doctor. Didn't tell me what he was about to do, just told me to lay down, did the DNC. He got mad at me for being discharged, but it was my first birth.
According to the March of Dimes, pregnant women who use doulas are 2 times less likely to have birthing complications.
I'm honestly kind of tired of us keep saying the statistics because we still have to put in that emotional cash to even prove that this is happening and having to relive our trauma and our harm.
Doulas are just one solution. Washington is one of 6 states that has legislation requiring some form of implicit bias training for healthcare workers.
So we still have to deal with not just...
McLemore says part of the solution is more legislation and diversity within the medical industry.
We need some training, we need some education, we need some people to get fired. Right? So it's lack of political will. And it's trying to solve a structural problem with individual solutions.
Ready? 1, 2.
Until the problem is solved, Black women are taking matters into their own hands.
Most people will survive their pregnancy and birth, and that shouldn't be the floor, right? It should be a joyous time, and you want to plan out with your team exactly what you want and how that experience should go.
For Keisha, one step was ensuring her care team were all of color.
I think trying to explain nuances that may be cultural or having to feel as if you're not able to be truly yourself because you might be in a room full of people that don't resemble you, feel you, or you feel that may not be as empathetic to who you are. So this is the baby's little face.
As Keisha and Adama await their baby boy's arrival, she encourages all moms to create their village.
I look at our child and the love that it already feels, and I'm just like, wow, I don't feel alone. This doesn't feel as hard as it would if I felt isolated and just carrying the weight on my own shoulders. I don't feel that way, and I'm very grateful that that's my pregnancy journey.
Come on, say the affirmations. I look fly, yes.
A network of moms supporting each other through movement. This space was created for them to be free,
Moms having fun.
to heal, and bond with their babies.
It gets your brain not focused on just the baby. Like, you can just be with your baby, which is the fun aspect, and just be able to do something and not, are they growing properly? Are they eating properly? Is their diaper wet?
Touch my swag, wish you could.
Instead, Aspen Struthers can focus on the positive affirmations.
Hey, go mamas.
Keisha Credit created the Baby Carriers and Friends dance class to support new moms.
To have a whole room full of people, I was just like, we partying, we dancing, and it's just up from here. The more the merrier. Like, if this many people need to come to this space and we all gonna heal together, then that's more energy. Hey, it works for me. So that's the baby's profile.
You may remember Keisha from our Facing Race story in July about how Black women were 2 to 3 times more likely to die during pregnancy and childbirth.
And I realize now that advocating for a team that felt like me, or at least could relate to the things that I wanted, was really important.
Is breathe in through your nose.
Keisha was 7 months pregnant then, building a team of color to ensure she had a peaceful birth.
From there, my doula met us at the hospital, and everything that we said that we wanted to do, she was able to definitely implement, which was awesome. It was not easy. There was a lot of pushback.
Keisha said that pushback came about 50 hours into labor.
And I said, if I push, I think my body's already gone too far. Like, I'm a little scared to push. I think like I'm gonna have a stroke or something like that. And so I said, no, I'm gonna need to take a nap. And the doctor was like, a nap? And I was like, yeah, I need to take a little nap or something.
Keisha's doula and her partner Adama were able to advocate for that nap. After 62 hours of labor, Serene was born.
There's just a lot of intimidation in the medical field. Women don't feel empowered enough to say or to feel like they can actually have a voice and speak back. With my doula, I was like, she got my back. We're good.
But as the new parents prepared to take Serene home, a frightening health scare for Keisha came up.
And so she explains to me, she's like, you know, this is something of preeclampsia, and she explains like what this is. And it was so emotional because I had heard about it, but I never heard about it post having the actual baby.
Dr. Patricia Iguatu is a family medicine physician with Kaiser Permanente. She says typically preeclampsia is diagnosed during the pregnancy, but after giving birth, moms can still deal with pregnancy complications.
When you think about preeclampsia, it's a combination of different symptoms. So you can have elevated blood pressure, so hypertension, and then you can also have like protein spilling out into your urine, so causing kidney damage. And then you could have gestational hypertension, which is just hypertension in pregnancy after 20 weeks.
According to the Preeclampsia Foundation, Black women are 60% more likely to develop the condition than white women. Dr. Iguatu says it boils down to structural racism.
So where an individual lives, they sleep, the air that they breathe, the food that they eat, the access to healthcare, all of those things can really impact an individual in terms of why they're more likely to get preeclampsia.
In the U.S., preeclampsia affects between 5 to 8% of pregnancies, and in most cases leads to preterm birth, according to the March of Dimes.
We need to get better access for Black women to all of those things I talked about. Unfortunately, it makes it really, I think it's really hard, and that's a lot of pressure on an individual to try to figure out how do you fix all of those things.
And then the crazy thing is when I start talking about it on social media, the amount of moms that were like, girl, literally, this happened to me. It was so scary. I had no idea. I didn't know what this was, like all of the things. And they're like, how come we don't know this as moms, that this is such a heavy thing?
Yeah.
After staying 5 extra days in the hospital, Keisha, Adama, and baby Serene were finally able to go home.
Okay, son.
Now the focus is on learning more about her son and leaning into her feelings.
And motherhood emotions,
Right.
it's so real. It's like you can't control the different thoughts that you have, and you don't know why you're feeling that way. Like, it's like some days you're like, everything's great, but I don't feel great.
Postpartum can come in different forms for moms, but Dr. Iguatu says having a support system is necessary.
So having people that show up for you, if it's not friends or family or doula, is so important because they can be really intuitive to be like, hey, you're not okay. Let's check in about these things. Let's bring it to your physician and let's talk about it and how do we make you better.
Woo! All right, you guys. You guys did good. Let's clap it up.
As these moms connect with their babies, Keisha hopes this new movement will encourage other moms to find the village they need.
I like to dance with my little one. It seems to calm him down quite a lot. So I was like, let's get together and have some fun and do it. So that's what we're going to do. So everybody kind of find your space. And we're not going to be in a circle. So we're just going to be all